Welcome back, everybody. If you or someone you know suffers from uterine fibroids, you need to know that there may be a very effective treatment for you other than hysterectomy. Now, Dr. Dana Dunleavy joins me from Windsong Radiology, where their interventional and vascular services include the treatment of uterine fibroids. Doctor, nice to see you again.
Thank you so much. Nice to see you.
Some people live with uterine fibroids just fine, but others have tremendous issues.
Yes, absolutely. And that's the biggest thing that we initially talk to people about is what is the biggest contraindication to any intervention is no indication. So just having these benign, non-cancerous growths doesn't mean you need to do anything about it. So sometimes people get worried, I have this mass in my pelvis, but you don't have to do anything unless they become symptomatic. But many people do become symptomatic in their later fertility years.
And let's talk about what some of those symptoms are.
So a lot of people come to us with menorrhagia or bleeding. So it can either be heavy bleeding during their period or it can be bleeding between periods. And oftentimes it can be very devastating that people feel like they can't leave their home because it's just unsettling to them to know what things are going to be like. Other symptoms would be based on mass effect, meaning that they have pressure or pain, or even that the uterus becomes enlarged, almost like you're pregnant, and can push on the bladder or the colon and make you feel like you need to pee a lot or constipated.
So the treatment that you can offer here, if you qualify, is a uterine embolization fibroid, right?
Correct, yeah. And uterine artery embolization or uterine fibroid embolization, unfortunately people use different terms, but it basically describes the fact that you're cutting off the blood supply to the tumors and they shrink. And so if we use an example over here, you can see here is the patient before embolization. So she came to us and has this large mass that's pushing on her endometrium. So she had tremendous bleeding throughout the month. And then she also had back pain because this is your spine. And then she had constipation because this is your rectum. And she also felt like she had to pee very frequently because this is your bladder. So afterwards, and she works and she didn't feel like she could take a full month off. It's usually about 5 to 10 days that people take off from work with this procedure and about 30 to 40 days off if they've had surgery. And so she wanted a non-surgical option, and this is afterwards. You can see now a normal uterus, and this mass that was here pushing on her spine is totally gone.
Amazing.
Now, yeah, it's really neat, and we don't have to accomplish symptomatic improvement, make it go away completely, but it's great when it does.
So basically, you're not removing it as a surgery would, but you're shrinking it down so it's not a problem anymore.
Exactly. So all of the fibroids shrink, and that's one of the other great advantages is it treats all of the fibroids. And this is done here in our angiography lab, and the way we do it now, traditionally it was from a femoral approach or through the groin, but we've moved away from that for a few years now, and we do everything through the wrist, so you don't have any sutures, you don't have anything that would delay you from going back to work. Essentially, you just have a little band, goes on your wrist for about an hour after the procedure, and then you can run around.
And how soon would a woman feel relief?
So they come back to see us in clinic a month later, and they're usually feeling improvement then. But it continues to improve. So usually by 6 months out, you're having maximal improvement.
That's amazing. And for men, we want you to know that you can use the same science to help a prostate issue.
That's right. So if we look at this as an example, here you have the bladder, and some people describe the prostate as a walnut-sized gland. And here you can see the urethra goes through that. So as we get into our 60s, oftentimes many people have some pressure and it makes it difficult to pee.
Well, it's remarkable that you can do this. And for people who have these issues, I know they're going to be on the phone. So by all means, log on and call Windsong Radiology. Meet Dr. Dunleavy. And this could all be behind you in a minimal amount of time. They call it UFE, Uterine Fibroid Embolization, okay? And they'll be happy to speak to you about it and relieve this problem for you right here at Windsong Radiology.